Hello everyone, I'm delighted to introduce our newly established large-scale clinical cohort, the longitudinal multi-omics study in patients with acute coronary syndrome, LM-ACS cohort. ACS accounts for over 7 million new cases globally each year, with the number of patients in China projected to reach 23 million by 2030. Despite significant advancements in treatment, patients with ST segment elevation myocardial infarction continue to experience high rates of hospital readmission and 5-year mortality. The post-ACS repair process is complex and influenced by various factors, including lifestyle, gut microbiota, and genetic predisposition. However, there is currently a lack of systematic longitudinal follow-up and multi-omics analysis studies. Our cohort aims to address this gap by recruiting participants from 4 hospitals in Shandong province. By integrating multi-omics data, genomics, transcriptomics, metabolomics, proteomics, and gut microbiomics, with clinical phenotypes, we seek to 1. Explore factors leading to MACEs after ACS, 2. Investigate early mortality risk factors, 3. Map cardiac remodeling and heart failure progression post-ischemia, 4. Analyze the impact of treatment strategies on long-term prognosis, and 5. Create a resource for studying ACS risk factors and mechanisms. The LM-ACS cohort recruits patients aged 18 to 85 who meet the diagnostic criteria for ACS, including AMI and unstable angina. Patients with malignant diseases and pregnant women are excluded. Upon signing informed consent, biological samples are collected according to standardized procedures and stored in a biobank under specified conditions and timelines. We primarily collect 2 types of biological samples, fasting venous blood and fecal samples. We also gather extensive clinical data from participants, with particular emphasis on the assessment of cardiac function. All data is obtained through questionnaires and hospital medical records. The follow-up plan of the LM-ACS cohort is stratified into 3 categories based on whether the patient underwent percutaneous coronary intervention, PCI, during hospitalization. The follow-up schedules slightly differ among the 3 categories. Long-term follow-up is conducted at 1 month, 4 months, 1 year, and 2 years post-surgery, during which biological samples and clinical data are collected at multiple time points. The incidence of major adverse cardiovascular events, MACEs, is monitored throughout the follow-up period. As of October 2023, the LM-ACS cohort has recruited 8,615 patients, including 5,301 males and 3,314 females. More baseline data can be accessed on the iMetaOmics website. The LM-ACS cohort is a real-world prospective study. Through multi-omics analyses of biological samples combined with in-depth clinical phenotypic data, it provides new insights into the mechanisms of ACS onset, recurrence, and post-myocardial ischemia cardiac structural and functional changes. We look forward to collaborating with other centers to enhance the and representativeness of the cohort, thereby expanding the scope and impact of cardiovascular research.